How do you strengthen your pelvic floor? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a great question, and I want to start by just saying you've probably heard of Kegels. Everybody and their mother has heard about Kegels, and everybody thinks that strengthening the pelvic floor, that you just need to do 1,000 Kegels a day or whatever ridiculous amount people are recommending. But I will say that's probably the most common answer when it comes to people asking about strengthening their pelvic floor is just do Kegels. Here's the thing, as a pelvic floor physical therapist, while Kegels have their time and place, we don't recommend doing Kegels in isolation, just sitting around and contracting your pelvic floor and trying to strengthen when you're sitting at a stoplight or you're in line at the grocery store. We're not recommending that you do that. So depending on who you ask how to strengthen the pelvic floor, you're probably going to get a different answer. Since you asked me, a pelvic floor physical therapist, I want to give you a better answer on how can we strengthen the pelvic floor without just isolating those pelvic floor muscles. So let's get started. So my answer with this is, why do you need a strong pelvic floor? Okay, maybe you're struggling with some kind of pelvic floor dysfunction like urinary leaking, or you have some prolapse symptoms or diastasis. You're likely having some kind of symptom that is pointing to your pelvic floor as being dysfunctional, or it's not working the way that you want it to. So what I would say then is, well, what are you struggling with? Likely you're probably noticing some kind of symptoms, whether it be leaking or pain or pressure, or something just feels off with functional movement, such as picking something up. Okay, maybe picking up your toddlers, maybe carrying them across the room, maybe carrying them at the grocery store while you're pushing a cart. Maybe it's when you're pushing something or you're pulling something towards you, but likely you're in motion, right? So why wouldn't we want to train the pelvic floor muscles in the functional movement way that they need to actually work? So that's my answer as far as strengthening the pelvic floor. We don't want to isolate and do just Kegels, but we want to be aware of how the pelvic floor muscles work and how we can be aware of contracting them and also doing that with movement. So let me explain a little bit more about that. So when it comes to the pelvic floor, it's part of the core, and most people think that the core is just the abs and that's what they need to kind of work on. But the pelvic floor helps to stabilize into our pelvis. It gives us support for our back, and they're postural muscles, so they have to work when we're upright and we're moving around. So as far as functional exercise, I would say that the best way to work your pelvic floor and to strengthen it is in those functional movement patterns, such as if I wanted to pick up a child, or if I wanted to pick up a car seat or a box or my laundry basket or anything, that's basically a squat, right? So what I would do to strengthen the pelvic floor would be to grab a weight, whether that be some hand weights like that, or a kettlebell, or a resistance band, and I would do something like squats, okay? Because not only can that work my pelvic floor and my core here and around, but also I'm getting my glute muscles, my hamstring muscles, and those are helper muscles for the pelvic floor, okay? Doing something like deadlifts, okay? It's very functional because how many times a day do you pick something up off the floor? You get something off the floor, then doing some deadlifts like this, now, you have to kind of pick the weight that you need in order to strengthen those muscles. But there's a lot of different versions of that. Maybe you could do lunges, okay, whether that be forward, back, to the side. But there's a lot of ways to incorporate the pelvic floor muscles inside a very functional movement pattern. Another thing we can do to work the pelvic floor is actually working our arms, using some weights here, because we can incorporate the pelvic floor muscles in the core again with some upper body strengthening. So we don't just strengthen the pelvic floor muscle in isolation, and also we don't just strengthen our biceps, for instance, in isolation either. Yes, that's the target muscles of this exercise. However, I'm stabilizing through my core and I'm engaging pelvic floor when I do that. I want to just direct you to another video that I've made. If you are right there at home and you're thinking, but I don't even know how to do a Kegel properly, what is she talking about? Check out our other Ed Talk video on how to do a proper Kegel. I've also done some other Ed Talks on how to properly engage the core using proper breath. So I didn't want to bog this video down with all of those details today. I do want to finish this video, one, by saying that Not everybody needs to strengthen the pelvic floor. So if you are noticing leaking, prolapse, or like a heaviness, bulging sensation, or if you have some concerns about your pelvic floor related to pee, poop, or sexual function, I just want you to know that a lot of times, especially other providers, not pelvic floor physical therapists, often tell patients or their clients that you need to strengthen your pelvic floor because it must be weak. However, I will say, as a pelvic floor physical therapist, not everybody needs to strengthen their pelvic floor. You may very well have a nice, strong pelvic floor and still have symptoms. So you may have tight muscles. It may be something unrelated to your strength. So I just want to finish with that. The other thing that I want to say is, if you are a mom, so if you've had a baby at any point and feeling stronger is your goal and you're not quite sure where to start, and this is especially for those moms that are newly postpartum, like your baby is a year or less old, and you are holding yourself back, you're limiting yourself because you're scared to get back to the gym. You don't know what to do, you don't know if you're going to hurt yourself, you don't even know anything about where to start. What I'm going to say is the best place for you to start is here at the Healing Spot. Head to our website, healingspotpt.com, and check out our postpartum page. And I urge you to reach out to us about our after baby return to exercise screen. It's a 45-minute appointment with one of our therapists. We actually go through exercise and we check to see how well is your pelvic floor and your core holding up. We know what to look for. We're going to educate you on that. And we're not going to give you the exact plan to get back to exercise, but we're going to give you peace of mind on how your body is doing currently. And for some of our moms, they get such peace of mind that we give them the go ahead and we never see them again. For other people, we notice that there's some concerns and we talk to them about that. They come in, they do some one-on-one therapy with us, and they get all of those problems solved and they get that peace of mind. So just reach out to us. Like I said, head to our website and we would love to answer any questions that you have. Thanks for watching this Ed Talk. We'll see you on the next one.